Okay. So just in case this is your first time being part of Mi Mentor, I hope you've downloaded our app or have, navigated the webpage. But our mission behind Mi Mentor is to really develop and support innovative, inclusive mentoring opportunities to inspire the next generation of healthcare leaders for underserved communities. So we do this with a lot of different platforms. So one of them including this sort of platform where we have a Together We Mentor. And this is a virtual event that we try to schedule an hour and a half. You've probably seen a lot of our TWLs. So those tend to be a little bit more like a conference style platform where it's like half a day. And that's where we have a lot of great conversations around health equity or really just addressing different ways of how we can increase diversity in the healthcare profession. And as I mentioned, we'll first hear about Dr. Gallegos' journey to his current position. Afterwards, we'll also hear about Argines Rubalcaba. He holds 2 degrees on Master of Science and then PMP, which is a professional in, I think, project management. Afterwards, we'll hear about their research presentation, and then we'll open it up for a Q&A. We already have some preset questions on the questions that y'all have submitted through the Eventbrite, but please feel free to chat to Mary Plasencia, and she'll go ahead and facilitate that portion. At the end, we'll go ahead and post the post-event survey. So in order for y'all to receive like the contact information of our amazing speakers, please complete the post-event survey. It just helps us to gather feedback in terms of how we can improve our services or like our events of how we conduct these. And without further ado, I'll go ahead and pass this over to Dr. Gallegos.
Hey, sorry about that. I'm just getting set up a little bit. All right, let me just do. Sorry, everybody. I should get it soon. All right, and then let me just new share. Okay. Cool. Are you all seeing the full screen mode now? Just
Yeah,
cool.
That looks great.
Right. Awesome. Okay. Sorry, I might have. I think I'll just go ahead and get started. A little bit about myself. So, my name is Abraham Gallegos. Please, though, I do go by Abe. You really are not offending me in any capacity if that's how you refer to me. I prefer it, but so yeah, I'm really grateful for the chance to just be able to speak with all of you kind of in this setting. So I'm a pediatrician by training, and then I'm actually a healthcare disparities research at the new Kaiser Permanente School of Medicine. I just started in October, so I've got a couple of months now. So I titled this talk, "Oh, the Places You'll Go," and honestly, this really just kind of goes to highlight the fact that I truthfully never expected to be in the position that I'm in. A couple different things. One, and just I do some health disparities research, and I do a little bit of health disparities research. That's kind of what I do primarily. And then I never really expected to be in any type of academic setting. And then again, the path that has kind of ultimately brought me to kind of where I am today has been a little bit circuitous and long and kind of drawn out sometimes, but look, in a lot of ways, I really think I'm the same person that I was when I first started. I don't know if you want to introduce yourself a little bit, and then I can go on from there.
Yeah, will do. So my name is Argenis Rubalcaba. I actually very much like Abe, didn't realize where I would be today. I didn't realize that all of the different roles, the jobs, the classes I would take would eventually connect, and the dots really connected to where I am today. I do have a slide to go over that roadmap. Maybe I can go over it real quick for everybody.
Yeah. Are you okay if I just do my thing real quick?
Oh, yeah.
Quick? And then that, just because as you all saw, it took me a little bit to get it set up. And then I will hand it over to you if that's okay.
Perfect.
Cool. All right. So thank you. All right. So I was born in LA at this is the old LA County USC Hospital. I don't know if you all are familiar with that area. Again, but I spent the majority of my life actually up until medical school in the city of Bell, which is again it's part of the southeast part of LA. It's a pretty like inconspicuous, like forgettable part of LA, unless you're kind of from the area. You probably, it's not a big part of LA architecture or just nomenclature. It's not a big part of LA. Honestly, it's probably best known for back in 2010, there was like this big city official corruption scandal that kind of saw a lot of the city officials kind of being grossly overpaid, led to a lot of like criminal indictments. It's pretty ridiculous. One of the city council members was making upwards of like $500,000 a year. This was at a time in a city where the median income for a family was like $30,000 to $40,000. So that's honestly probably what it's best known for, which is kind of sad. But like it's similar to a lot of the neighboring cities and similar to like a lot of parts of LA, right? It's largely Hispanic, largely working class and lower socioeconomic status, urban, pretty densely populated. So that's kind of where I was born and raised. So I went to, this is just a picture of my local high school, Bell High School. Like again, admittedly, I really didn't do particularly well during the first part of my academic career. I was a pretty average student. But I think I would later really become inspired by my mom. So she went to school later on in life and kind of would eventually become like a Head Start teacher when we were a little older. And then it kind of just hit me one day. If this woman, right, can immigrate, can come from Mexico to the US, kind of not knowing the language, be the mother to 4 children, gonna work full time and educate herself, then I can, and honestly, I should too. So that's kind of when I really started to pick things up in the second part of high school. But honestly, I went to a small state school, Cal State Dominguez Hills, for college, partly because I didn't have the grades, and honestly, partly because I just really had no idea what I was doing. But I was really fortunate enough. Dominguez Hills was really good to me. I was really able to get my act together, and I was really fortunate enough to do really well here. It definitely wasn't an easy transition to go from, kind of lackluster, just kind of student to like really excelling academically, right? I had a lot of bad habits I had to break and kind of other obstacles that I had to address and overcome. But I was, fortunate enough to be able to do that. And then after graduating, I took a year off of it. I was a science teacher at a local middle school in East LA, the city of Boyle Heights, actually, which is a pretty big part of the specific Hispanic and specifically Mexican kind of community here in the LA area. So I did this for a couple different reasons. I did it because I was really just overwhelmed by the entire process of applying to medical school and kind of really didn't receive a lot of great mentorship during college. So I kind of wanted to just prepare myself, study a little more for the MCAT. And then I always wanted to be a positive influence in the life of kids kind of who grew up like me. So I thought this would be a good opportunity to do that. And then it's funny just to kind of highlight this idea that I wasn't always the best student. This is just a random picture of a grade of a report card, but I was a life science teacher at Hollenbeck Middle School, at the middle school where I was teaching. And I actually got a D. I remember looking at my old report card. I ended up getting a D in that same class when I was in 7th grade. So these are the things that I find super funny and amusing. But during also that time, so I took part of the pretty instrumental program, this undergraduate pipeline program at UCLA. called UCLA Prep. Many of you are probably familiar with it or even been part of it. And I kind of ended up going to UCLA for medical school there and my pediatric residency training. And again, throughout a lot of points of my medical education career, there's just been kind of a lot of like these fork in the road moments where really I kind of had to make a conscious decision about my next step, right? Moments where kind of I had to look like at who I was, what are the certain things that I'm passionate about, and really see kind of how I wanted to see that manifested. So picking residency was really a big, example of that. I remember feeling really just unsure about kind of where I wanted to do my pediatric training. I always thought, I'd be a physician kind of on the front line, really taking care of kids of color and underserved communities, working in, local community clinic. That's kind of how I saw myself, right? Using my Spanish to really serve those kids and serve the parents. And I remember just asking myself, like, is this program, UCLA, the pediatric residency program, going to let me be that physician? And I remember really having big doubts about it. And so, but after taking a little bit of time to think about it and really kind of talking to some mentors, I kind of made that conscious decision that I would go there and I would do my pediatric residency training. And I remember like the main reason really, I wanted to be a place where I would be pushed, right? Where I wouldn't be comfortable, where I would be in an unfamiliar setting. And then I wanted to be the best clinician that I could be, and really kind of work with, some pretty sharp people. Because like I wanted to be a community outpatient pediatrician at the time, but I also really wanted to just be a really, excuse the language, but just a badass clinician, right? I really wanted to, I remember thinking, right, I could specifically use this training and kind of take it to those communities. And then, once I got there, though, I made a couple different realizations about the program. It wasn't really nearly as big and scary as I had like envisioned it in myself. The UCLA Pediatric Residency Program was a great program for me. And just specific to that program, it was great for community pediatricians serving, right? It was a wonderful opportunity. And I just mentioned it here just to kind of highlight the importance, I think, that a lot of us, URM and first gen students who are kind of along our path kind of sometimes have to make these kind of really conscious decisions to put ourselves in uncomfortable positions. And I know medical education and just undergraduate, all this education is really uncomfortable, but sometimes we need to just take a moment and have those fork in the road, decisions and really make some of these difficult decisions. And also just, and the pediatric residency was just a really good opportunity that let me really understand that there's a lot of different ways that I could serve underserved people. I remember having this kind of like false idea that just because I wanted to serve underserved people, I kind of needed to be this outpatient community pediatrician who was working in a really underserved community. And right, I saw, and again, but about the time that I kind of was finishing residency, that kind of was just no longer my desire. And we'll talk a little bit about how that changed. Don't get me wrong, we need a lot of physicians of color in every capacity in medicine. We need them in community patients, community, in every facet, right? We also need them in administrative roles, kind of pushing research agendas, public policy agendas. We need them as subspecialties. We need people of color and first-gen students kind of in every capacity, in every facet of medicine. So after I finished my residency training, this is a picture of obviously an ambulance and a helicopter. I was a transport physician at the Children's Hospital in LA, where we would essentially pick up kids from other hospitals and either bring them to CHLA or kind of just help out with the transport. It was pretty cool, able to hang out in a helicopter every now and then, but or in an ambulance, but that was a pretty good experience. Then I ended up actually going back and did this program where I ended up receiving health services research training. So I could really kind of conduct healthcare disparities research. And I kind of just recently came on board as this assistant professor with the Health System Science Department with Kaiser. And then just to kind of finish a couple different things. So I identify really strongly with some personal characteristics, right? Like no matter how far I've come and kind of no matter how far I go, I think I will always see myself as like this Mexican kid who kind of grew up from LA and kind of had a grind and just slog his way through medicine. Right? I will always view myself that way. And although my career has taken a path that I really didn't expect, at its core, again, the main motivating forces really haven't changed much. Look, I want to serve underserved people, right? For no other reason than, those are kind of like my people, right? We share the same experience. I kind of grew up in those circumstances, and I share a lot of the experience that they have. And I say it here and bring it up explicitly just because, these three identifying, my Mexican culture, right? The fact that I'm from LA and I identify, love it. I love being Angelino. And then my first gen status kind of were really important to just making me as a pediatrician who I was. But even now, right, as this healthcare service researcher and disparities researcher, they've really been impactful kind of just forming how I view things. And to kind of highlight this shift, I usually like sharing some images that were pretty impactful during this transition. So, so Mexican and Mexican American art can take on some pretty revolutionary themes, right? Absolutely, it's beautiful imagery, right? But it's so much more than that, right? It screams change. And the intention of a lot of these paintings is really kind of to give these modest and exploited communities a voice. And the further along I got into my academic career, right, the more it became pretty apparent that I'm a minority. And I remember just thinking that's kind of a weird thing to say, that I'm a minority, right? I'm sure a lot of you know, like, hey, Abe, yeah, I know we're a minority. But I grew up in a super homogenous community. Everybody looked like me, right? But the higher I went up, the more I noticed, again, people really started not to look like me. And that became even more apparent, right, when I started looking at faculty positions in medical schools or physicians with administrative roles in like healthcare systems, right? People really did not look like me. So I think that realization came at the same time that I really just began to recognize that I have a voice, right? And like our healthcare system really needs to hear my voice. And I just kind of realized that I could use my voice to advocate for underserved communities and really kind of keep our healthcare system accountable. Because, yeah, absolutely, my voice represents my own lived experience, my family's lived experience, right, as a URM and, immigrants here in kind of in the US and locally. But more importantly than that, my voice represents, my community specifically, but other underserved communities. And that voice can be used to, again, advocate for them. So, and again, like, I feel like this artwork gives a voice, right? I really kind of want to be able to use in my career as kind of a voice for these communities. I'm sorry, so I'll stop sharing. Please hop on board, get in on this.
Will do. The more I hear from you, Abe, the more I realize that we're actually very much alike and we have similar stories. So I'll be sharing my pathway with everybody. Let's see. Let me know if you could see it on your screen. It's a PDF.
Yeah, looks good.
Okay, perfect. So so my name's Argenis. In school and at work, sometimes people pronounce it as Argenis. I'm okay with Argenis or Argenis. It's something that I grew up with. And I was born in LA, specifically Northeast Los Angeles, Highland Park, and the San Gabriel Valley. I was actually born at Women's and Children's Hospital when that facility was still there at LA County Hospital. I know Abe showed a picture of LA County Hospital, so I'm very much familiar with that hospital.
Yeah, man, I was born there too. Hey, more in common than you. Yeah.
See, the more we talk to each other, we realize that we share something. So I went to UC San Diego for school. Out of high school, I knew I wanted to go into the biomedical sciences, but I wasn't sure if I wanted to go into medicine or biomedical research. And so what many schools offer are programs for students who want to learn more about biomedical research. And at UCSD, there was a program specifically focused on trying to develop students who were from underrepresented backgrounds. So me, someone who's first generation to go to college, first generation American. My parents are from Mexico, and as someone interested in biomedical sciences, I joined this program, IMSD, and I was part of it for an entire year, and later realized that some of the techniques that I was learning, I wasn't super interested in, but I was interested in the sciences. So that experience led me to want to look a little bit deeper into biomedical sciences, into psychology. I ended up exploring psychology a little bit more. And I wrote down TRIO student support services. That's going to be really important, especially because of the work that I do now. And that's research and support services for medical students. So after my second year at UCSD, I applied for a program called the SHPEP. It used to be called SMDEP. The name has changed, and it's very much like what Abe had talked about, the PrEP program. So this program essentially is a summer program to try to introduce students to biomedical sciences, to public health, to medicine. And the program that I was a part of also introduced students to dentistry as well at UCLA. And it was through this program that I learned my interest in public health research. So I went from exploring biomedical science research to exploring public health research. And then it was at UCLA and at UCSD actually that I had heard about Mi Mentor. Mi Mentor holds a very, very special place in my heart because of the mentorship that I've received from some of the people involved in Mi Mentor. And because it was one of the first times that I got to be a leader. And that's one of the important things that students should think about, because many times we're afraid to take on leadership positions. Many times we think that we have to have a certain degree to be a leader. And there are many opportunities for students to join a student organization, to take on a leadership role. Sometimes we have a leadership role at home. So leadership is something that everyone should look into. Mi Mentor was also where I discovered my interest in user experience. And that's going to be important as well for my story and the type of research that people can do, because there are many different types of research. After graduating from UCSD, I then applied for the UCI School of Medicine Post-Bac program. So that's one of the Post-Bac programs through the UC consortium, and I thought it was an amazing program. Many of my friends are either now in residency or physicians, and so the Post-Bac program can really help students to either take science courses that they may have not taken in undergrad, or to augment and really prepare them for medical school. So the UC Post-Bac programs are excellent. One of the things that I did when I was in the Post-Bac program was to take part in the summer enrichment programs. And so I served as a coach, a research mentor, and a resident advisor for students. And the group that I led, the group of students that I led, they published a meta-analysis. So a meta-analysis is essentially where you look into different studies that have been published, and you try to identify what these studies have in common, and you ask a question to look a little bit deeper. And so what we looked into was whether a partial dose of antenatal steroids on intraventricular hemorrhage, IVH, if that plays a role in premature infants. And so that's something that's very important to me, this type of research in premature infants, because I have family that they were preemies and had health complications. So it was something very important to me, and that's one of the things that that's important to consider, that you can do research in something that you're very passionate about, just in the same way that Abe does health disparities research, looking at health systems. Perhaps there's something that you're very much interested in, and research can really make a difference in a very macro way, in a very large scale way. After the UC Irvine Post-Bac program, I decided to go back to my community. I decided to go back to LA and to do service through Americorps. So Americorps is kind of like the Peace Corps, but instead of doing your service in another country, like for instance, doing health education in Guatemala, through Americorps, what one does is they go to a high need community in the United States, and it just so happened that I got to go to my own community. I got to go to Los Angeles, and it was through that experience that I then built connections with people that are still my friends today, and where I was able to eventually be employed. I was eventually able to get a job through this. And one of the positions that I held while being at Ultimed, so this was after my Americorps service, was being a research coordinator. So I was a research coordinator in the research and evaluation department. And one of the studies that we did at CHLA, it was a collaboration between CHLA and Ultimed and First Five. So we did early identification of referrals to early intervention services for autism and other developmental delays. And after talking to Abe, that's another thing that we're both interested in doing research in. So that it's a small world, and you realize that there are other people that are interested in a lot of the things you are. After Ultimed, I decided to go back to school. You might get to a point in your path or in your journey that you realize that you might want to take a year off. And there's a number of people who do a gap year to learn a little bit more about yourself, to perhaps strengthen your application to a medical school or any other health profession school. And so for me, my Americorps experience was exactly that. And I was ready to go back to school. And so I decided to go back to school. I did my grad school at Cal State LA in healthcare management. So essentially, it's healthcare administration and focusing on health systems. That schooling actually led to an opportunity that opened up at the Southern California Permanente Medical Group. So this is the SCPMG is the physician group in Southern California for Kaiser Permanente. not to get too granular about it, but Kaiser Permanente is kind of this large entity that's the healthcare payer and health insurance, and SCPMG is the group of physicians that provides care to Kaiser Permanente members. And so I was supporting SCPMG in the consulting and implementation department for a number of different healthcare specialties. And that's where I learned more about healthcare systems, health systems research, and the type of research that's required in order to do healthcare consulting. I also gained insight in quality improvement that's very, very important to healthcare. And many of you will be learning about quality improvement or QI work if you haven't already. I also learned about design thinking and was trained in the design thinking methodologies taught by the Kaiser Permanente Design Consultancy, and that's based out of Oakland. So after my time with KP and SCPMG, I decided that I wanted to go back into academia and support services and research. I really liked my experiences at UCSD, at UC Irvine, at UCLA, and so I figured that it was time to go back. And so Kaiser Permanente opened up a school, the Kaiser Permanente Bernard J. Tyson School of Medicine, and I knew that it would be a perfect fit just because of my understanding of the health system and because of the type of work that I really enjoyed doing, and that's support services. So I landed at KPSOM, and at KPSOM I managed 27 scholarly projects. So those are research projects supporting over 27 students, so medical students. As of now, we have two classes of medical students. We have the first year medical students and the second year medical students. And there are 4 years of medical school. So eventually I will be supporting 4 classes of medical students and a lot of scholarly projects. So there's a lot of amazing research that the students are doing, and I'm so glad to be a part of it. And lastly, I included this here, PMP. I became a project management professional through the Project Management Institute, and I continue to develop myself. So professional development is important, and whether regardless of what you end up doing for work or what you're very interested in, professional development, continuing to develop yourself is going to be really important. So one of the things that I'm doing now through UCLA Extension is a user experience design and user interface user UX research certificate. And so it's through this extra learning that I have gotten to know more about user experience. I realized that that's another type of research someone could get into. For instance, nowadays, telemedicine is very important, and the apps that people develop and the way that the app works, whether the provider is having a good experience, like if it's a user-friendly app, or whether the patient is able to do what they have to do in order to get care. So that's something that's now really being looked at and considered in healthcare, especially because technology and healthcare are becoming more and more entwined every single day. So that's something that I continue to learn more about, and it shows that there's so many different types of research, and research keeps changing for the better. So that's me.
All right, thank you. So I think the next thing that we wanted to do, and we were going to do this together, is just kind of highlight a little bit of a project that I have done to kind of just show the different types of kind of research that can be done. Yeah, so I'm going to share. And then we'll finish up with that, just so y'all can see again, and we'll get questions specifically from y'all, but cool. Just so we can get a little better understanding of kind of what we, the health disparities type research that we do. So I'm gonna start sharing this. Cool. All right. So yeah, so cool, perfect. And then so that again leads me to kind of where I'm at. We're both here at Kaiser. But so my time is actually spent mostly doing research in healthcare disparities. Actually, 70% of my time is with that, and the other 30% is like working with med students. I'm actually not currently seeing patients at the time, and kind of again, we'll see how long I do that for. But so just to highlight one of the projects, it was this project that was called Racial Disparities in Developmental Delay Diagnosis and Services Received in Early Childhood. So, so again, if you might have heard this already, right? But things like developmental delays, right, are going to be things like if a kiddo is struggling with vocabulary, right? Maybe they're just not speaking at all, right? Or like gross motor delays, right? Maybe kiddos are just not, walking as they should, and kind of they're not tracking, right? We normally have a pretty predictable like progression on how we developed, both with our speech and kind of like our ability to walk and use our big muscles, small muscles, and stuff like that, right? So that's an example of just like a developmental delay. Then you have other things like developmental disabilities, which again, which is kind of what this specifically was focusing on. So this slide is just kind of showing just the proportion of children diagnosed with a developmental disability has kind of gone up over the last couple of decades. Most people, most research really think this is just because we're better at detecting it. But again, examples of developmental disabilities are going to be things like ADHD, right? Autism, cerebral palsy, learning difficulties, or intellectual disabilities. Those are just an example. You have other stuff. So yeah, so those are just some examples. So the most recent kind of data that we have here is just that it's about 17, 18%. So if you think about it, that's about 1 out of 5 kids. This is showing 3 to 17 are gonna have some type of developmental disability. So that's pretty high, right? So it's not an insignificant amount of just kids and kind of throughout the population. So digging into the numbers a little bit, you kind of quickly see some differences in the proportion of some of the specific disabilities. So we see that the rates of ADHD, ASD is autism spectrum, and honestly, truth and other developmental delay was just a survey kind of just used this umbrella term if it wasn't some of the ones that were labeled. We see that it's lower for your Black and Hispanic children, right? Autism, they're less likely to be diagnosed, and with ADHD also, right? It's pretty significant. There's a pretty big drop off. But what's interesting, we do see a couple developmental disabilities that have a higher proportion in children of color, right? The big one kind of being here, intellectual disability, and specifically here with Black children more likely to be diagnosed with a learning disability. So when you see differences in kind of the rates of some developmental disabilities versus others, it kind of made me ask this question, right? One, like how reliable are these numbers, right? Are the differences in the rates that we see from one developmental disability to the other, is that just natural, like prevalence and epidemiology is just that's just how it's naturally presenting? Is that like essentially real? Or is it possible that maybe ethnic minority children with developmental disabilities are just being missed altogether, right? And that's why we're seeing these kids have lower rates of autism and ADHD? Or is it maybe that kids of color that have ADHD or autism, maybe they're just being mislabeled, right? And being misdiagnosed by the providers. And that's why we see higher rates for things like learning disabilities and intellectual disabilities, right? Is that, so I kind of wanted to clarify that a little bit. And to do this, so we need a couple things. We need a group of children where we're kind of able to know if they've been diagnosed with kind of one of these disabilities. But we'd also need some like objective tool, some measure to kind of track how the kids have been developing, right? Objectively, like an actual score, like a real way to look at how these kids have been developing. So those are the two things, right? Have they received the diagnosis, and kind of how were they developing objectively? And we kind of really wanted to focus on the role as the physicians. Again, my specific interest, I'm more interested in my role and our role as physicians, right? Because I feel like when we talk about disparities, we're really quick to talk about patients and healthcare system, like insurance, stuff like that. But I think we're really quick we're not as quick to really talk about ourselves. And I really think that we as physicians are contributing to a lot of these disparities. Anyways, that's a whole other issue, but specifically I wanted to focus on physicians. So we looked at kids before they go to school. And we did this because usually for kids right before 3, 4, they're being seen pretty frequently by their pediatrician multiple times a year when they're babies, right? But once they start school, you're not seeing them nearly as often, maybe once a year or something like that. So that's kind of so that's what we did. Okay, so we use this study, this cohort, this other kind of just data of kids. It's called the Early Child Longitudinal Study Birth Cohort. It's not important to know that, just literally to know that there was about 8,000 to 10,000 kids that were followed essentially from birth to kinder, where they got some data collected from them, right? They would conduct some prenatal surveys at the 9-month-old, 2 years old, 4 years old, and kinder, where they would conduct some developmental assessments, right? This gives us an objective measure of how these kids are developing. But it also asks the parents a series of questions, whether they'd actually been told by their doctor, again, if they had received a developmental disability. So that's kind of what we used. So our outcome, it's a little different when kids are less than 3. Some of the labels, if you will, for developmental disabilities and diagnoses are a little different. But anyway, so an example of a developmental disability was like speech delay, intellectual disability, autism, and pervasive developmental disorder. So we kind of also wanted to see for this study these covariates. These are other just variables, like how does race, sex, all the stuff that you see here, right? How does that impact the likelihood of a kiddo being diagnosed or not being diagnosed with a developmental disability? And this is just the analytic approach that we took. I'm happy to talk more about, but we don't need to get bored with all the details. So this is just looking at our demographics. We see about 8% of the children. It's a little older, which is why some of the percentages are off from what I initially told you. But anyways, we see about 8% of the kids were diagnosed with a developmental disability by their doctor. And this is, yeah. So this is just your initial kind of table, right? This here is like whether they had received a diagnosis. This is, again, looking at how they scored on those developmental assessments. I won't go over them. This is kind of some of the race breakdown, some of the sex, and the language that are spoken at home. Again, down here is the other variables that we were looking into. And again, we'll get into some of the more significant ones in a little bit. So this is kind of, whenever you're running this thing called the multivariable logistic regression, it's just kind of like this table, and it's kind of just put here for us, and we'll go over it. So again, this type of analysis, though, it's good and it's helpful because it's really able to look at the contribution of each and individual one of these variables while really kind of taking into account the other variable. And we'll talk about that, kind of what that means in a little bit, but the full list is again there on the right. So Yeah. So again, essentially this number here, just to help us reading it, is if this number here is above 1, that means like right here, that if it's above 1, it essentially means that this variable is more likely, it's more associated with receiving a diagnosis. As opposed to if it's less than 1, then that means that it's less likely to be associated with receiving a diagnosis. So we'll go through these a little bit. So we see children who scored low on their developmental assessments had a much higher chance of being told by their doctor that they had a developmental disability, right? Makes sense. And this is just an example. We followed 2 different scores. So this is essentially saying if kids were consistently scoring below the 10th percentile on these developmental assessments, they had a lot higher chance of, kind of makes sense, right? If you have a test and the test is showing that the kid is struggling developmentally, then it makes sense that their doctor has picked up on it and has told them, hey, your kid has one of these developmental disabilities. But some of the other more important things, so we see that kids attending childcare were more likely to have received a diagnosis of a developmental disability. Also kind of makes sense, right? You hang out with other parents, you see other kids, maybe how they should be developing, or you're interacting with other parents and you're able, that's something we could like to refer to as social capital, right? You're like, oh, have you noticed, you should talk to your doctor about that. Also kind of makes sense, but this is, again, one of the areas where I'm specifically interested in. We also see specifically that ethnic minority children are less likely to be diagnosed. So again, all of them we see here are kind of less than 1, with the lowest probability kind of being those Black children. But we also see if a child spoke a primary language at home other than English, we also see that those kids were less likely to be diagnosed with a developmental disability. So again, this is just what we ultimately were able to show was that kids of color, as well as children living in a home where their primary language was in English, were less likely to receive a developmental disability diagnosis by the doctor. So again, what's good about this type of study is it's telling us that the differences in the rate of these diagnoses, right, in these kids is really not explained by any of the variables that we talked about in that model, right? So that is, sorry. All right, so, and again, what that ultimately translates to is, again, so that the reason these kids of color and the reason why you see a gap in the rate, it's really not, it has nothing to do with the fact that these kids is just the natural epidemiology, right? It's not because of access, it's not because of income or parent education or anything to do with any of the variables that we listed here on the bottom of the slide and that we had in our model. Right. What this type of analysis lets us do is it kind of, again, it gives you the likelihood of that one variable while taking everything else into account. So, so again, I would really just argue that some of the differences in the rate is really because of the issues that happen within the patient-physician encounter, right? And at least some of the differences, right, in this rate is likely because pediatric providers and really are not able to like effectively identify these children, right? Because of issues due to implicit bias, lack of cultural competency and other stuff like that. Again, we didn't really look into that here, but yeah. And then that's it. That's all I specifically. So that's kind of the type of work that I'm kind of interested in doing. And again, I'm still really new to this and still learning. So yeah, John and Adhanis, I don't know if you want to, anything else specifically to that, or kind of we can first happy to open up the questions, or Joanna, whatever you think is best.
Yeah, I was just going to chime in and say that having a sample size over 7,000 that's important. It's sometimes when someone takes on research, not having a large enough sample size can be an issue, and so it sounds like with this study there were a lot of people that were looked at.
All right. Thank you both for like your amazing backgrounds and really explaining your journey for all of us. And also like that research, like that's a really great example and really amplifying like the voice a little bit of like how important it is for, you know, a diverse group of folks to really join these professions because it really does matter. um, so folks, now it's that time for the Q&A. We already have that preset questions like I mentioned, but if you do have any questions that are, you know, that you would like to ask, feel free to either unmute yourself or chat it in, but we'll begin with some questions that were submitted through our Eventbrite.
Yes, so thank you so much. I just want to make sure everybody could hear me. Okay.
Yes.
So one of the first questions we received was if you could discuss academic medicine and financial stability, as well as being in academic medicine as the Latinx physician.
Yeah, so there are a couple things. Yeah. Yeah, so I guess I can speak first to just the academic kind of experience. It's tough, you know, like I want to be as transparent and vulnerable and real and just me as I can. That's just who I am at its core. And I kind of want to make this. Anyways, yeah, it's tough. It is not easy in any capacity. It's hard, right? And I think part of that is just, it's really, and again, I'm sure a lot of you have experienced this and are experiencing this now. It is not easy. Sorry, one second. Sorry, my dog. Yeah, it's not easy, right? It's isolating. You're kind of a little on your own. But you know, you make community where you can, right? The Kaiser Permanente grew and Dr. Montes, who was here, might have kind of had to step out. We're part of the Latinx faculty community, so you make community where you can. But yeah, but what I would also say is, look, we are not the only ones kind of who are struggling with some of this. There's a lot of other URM. So you kind of draw community even with outside of your immediate, right, kind of identifying, right, race or ethnicity or culture. And then there's a lot of other allies, right, who kind of want to see you succeed, right, who kind of get it and kind of want to propel you forward and move you forward, right? If it wasn't for, you know, allies, I wouldn't be where I'm at and I wouldn't be as successful as I am. So I think you do a little bit, right? I think you build community absolutely where you can. And then, but I think it's, yeah. And then as far as like you build community where you can, but again, also just recognizing that there's a lot of people who want to see you do well, right? And kind of learning to interact with them. And again, it's awkward, it's hard. I'm a really awkward, shy, introverted guy at heart. Don't let any of this fool you. It's weird, it's difficult, but again, it's worth it, right? Because I think we have a mission, we have a motive, right? At the end of the day, we are here to be of service to, for me at least, kids. I'm a pediatrician, right? That's where my heart is, but I'm here to be of service ultimately to kids of color and to like want to see them do well. So if that means I got to be in awkward positions, and if that means I have to be in an academic setting and feel uncomfortable all the time or most of the time, then, you know, ultimately that's kind of what I'm going to do. As far as the financials, that's a funny question. And what I mean by that is historically, academics is considered, you know, you tend to not make nearly as much. But, you know, at least at Kaiser, that's being changed. I'm getting paid pretty well for what I'm doing. And again, I think for a lot of us who come from these communities, the finances should never be a reason why you do or don't do something in medicine, because ultimately, you know, yeah, again, that's a whole area, but I think it's pretty safe to say that, you know, the finances, yeah, you absolutely are not going to be making as much as you could be making if you were like just seeing patients, right? Or if you were out there in the community seeing patients, you do to get you a little bit of a pay cut, but again, I think, yeah, anyways, go ahead, please, let's get in on this.
Well, I think, can you ask the question one more time to see how I can provide my input on it?
Yeah, so the question
yeah.
was academic medicine and financial stability, as well as being a Latinx physician.
Well, I'm not a physician. I do have to say that. I think there's definitely, to Abe's point, there's definitely a need for Latinx academics and people who are going to be allies and people who are going to be there to support along the way. So I think, things are starting to change, and where the finance piece changes is when companies start to realize how important it is to have representation in their companies, and when it goes to leaders, and we're leaders. It's not to say that someone has to be the CEO of a company to make big decisions, or has to be part of the Senate to make a big decision, but yeah, when people start to realize how important representation is, that's where you start seeing more of academia being represented, and people being paid what they have to be paid, what they should be paid. So that's all I could say for that piece.
I think a lot of people are wondering if you had any advice for college or like any type of guidance.
Oh, sorry, Mary. I think you were cutting off a little bit.
Oh, sorry. Okay.
Try it again. Let's see.
Can you hear me?
Yes. There you go.
That's just the question. We heard most of it, but when you asked the question, it started breaking up.
Oh, sorry. It was people looking for like guidance or advice for pre-meds that are still in college.
Yeah. So I think a couple different. Honestly, like for me, one of the main reasons I kind of wanted to do this was just to really highlight. I think sometimes, like with us, right, and with academic, like in communities of color, right, specifically the Latinx community, and as we're making our way, like it's a long process, right? Medicine is a long process. But I think sometimes we get a little tunnel vision and like what we can do and what we're going to be and kind of how we see it. But I would hope that for a lot of us, right, what's ultimately motivating us is to be of service, right, to our community, whether it's our small, like this small area in the Latinx community or whatever have you, right? There's anyways. But I feel like I would hope that would be the motivating force for what we're doing, a lot of what we're doing. So, and again, I think sometimes we get a little tunnel vision, right? I felt like I needed to be an outpatient pediatrician, no matter, and I kind of felt forced to do that. And not that I don't kind of ultimately, but it really, sometimes I think we do it to our detriment and we don't see what else is out there, right? And we don't see how else we can best serve those communities of color and right. And kind of that's what I wanted to highlight, right? There's a lot of other areas that you can be of service. One, being as a physician, or not even being a physician and still serving that bigger purpose. But specifically because it comes to the question for guidance and yeah, look, I think I would specifically, depending on where you're at, yeah, I think the mi mentor is a super big part of it, right? But one, I think just being familiar that it's out there. Two, there's a lot of steps you got to take, and like the reality of it is you can really get into it early. And Andres, he had a really wonderful presentation on how kind of he went about it. The PDF was super insightful and helpful. When it comes to the physician-specific perspective, you know, it's a long path from pre-med to college to, But you'd be surprised, right? Although it's maybe not exactly medicine, a lot of this type of study is being done in social sciences, right? So not exactly in medicine. There's other areas in which this is being done, or it's maybe a little different. So, again, if you don't specifically have, if you're not associated or affiliated with like a bigger institution, let's say, you can do a couple different things. You can look into like community partners. So I heard Simon mentioned the First 5 LA. It's a really big program. They do a lot of community-oriented research group. So that would be really big if it's something that you're interested in, just finding out a little bit more. So one would be specifically academic centers, right? If you're associated or affiliated with a bigger, if you're local to, again, UCLA, USC, Kaiser, if you're Ultimate, right? If you can maybe get plugged in there. Or if not, community centers, FQHCs, a lot of federally qualified health centers do a lot of quality improvement work, right? And that would be a wonderful source in which you can volunteer, in which you can kind of get nuzzled in and really kind of figure out what they're doing. That's one. And then, and again, yeah, and the higher up you go, especially in medicine specifically, the more you'll see kind of people are doing this, and kind of the closer you'll be to the action. Yeah, I don't know if there are any other thoughts. Or...
Yeah, I second everything that's been mentioned, and I think that it's important to really try to understand what what's going on when it comes to health in the community. If you're at, let's say you're at UCLA, or let's say you're at a community college, it's important to reach out to counselors to see what resources are available. It's important to get plugged into the student organizations, whether it's, I was a part of Chicano Latinos for Community Medicine. That just happens to be a popular one at UCSD and UCLA. And there's other student organizations. So I think really trying to see what resources are available at your school, in your community, perhaps at a nearby organization, AltaMed being one of the nation's largest federally qualified health centers, FQHCs, happens to have a number of different summer programs and employment opportunities. And sometimes you may be in a position where that you're going to be starting medical school, but there may be a gap year. These kinds of programs are perfect for that because the expectation is that it's usually a year or less, and you'll be really able to immerse yourself into healthcare and health disparities. And you'll learn a lot of things that you'll be able to apply once you're a physician or a health professional, how to do QI work, how to do research. You learn about some of the other departments that you may have not thought about before, including health education. One of my the best experiences that I've had so far that I still think about and would never have changed was working at the PACE Center, so Program for All-Inclusive Care for the Elderly. Yeah, it's important to see what opportunities are out there, and there are many. So if you're on the path to go to medicine, there's many programs that are focused on medicine. If you decide that you want to study medical anthropology and you want to do some health, work in the social sciences, excellent. That's needed as well. So there's many different ways to be able to help others.
Awesome. Thank you both. And really awesome, answers. So we did have a question that came in, and the question is around how many gap years are acceptable. Feel free to whoever likes to chime in or provide thoughts.
I think there isn't a certain number. I'm not on admissions. I happen to know people who applied to medical school many times, and they had many years in between, and they went on to medical school, or they went on to another kind of graduate program. So there's no specific number in order to be accepted or not to be accepted. And the same goes for GPA, and the same goes for MCAT scores. There's no specific number. You are a human being, and you offer, different kinds of qualities and experiences.
Yeah, for sure. I think, what we're starting to see a trend more and more in kind of medical education where, one, I think racial, ethnically, things are finally starting to change, right? If you look at the actual number and like the practicing physician demographics, it's abysmal, right? There hasn't been a big change in decades, but like UCLA, for example, right before I left, right, they had just it was the most diverse, right, first year med school, like, so anyway, so we're seeing these small changes in demographics, but something else that's super important that's changing is the non-traditional student, right? So to answer that question, like there isn't so much a have to have a gap year that's only like, even now there's multiple medical students that I know who have been off for like 5, 6, 7 years, right? I think part of it, I think the bigger question is going to be like what you're doing in that break. And look, the reality of the matter is maybe you didn't realize that you wanted to do medicine until later on, right? And hey, it is what it is, right? Or so I think, and again, but more than anything, I think it's less worrying about the number and more kind of explaining it. And again, not to like justify, yeah, John has been off for 6 years. Yeah, it's not so much like justifying, but like if it can be explained, right? And then again, but also like on a super practical note, using that time, right, doing something constructive. And again, if your goal is going to be ultimately to go into medical school, using that time to, if it's studying for the MCAT, if it's getting more experience, is it just right getting research experience, if it's clinical experience, right, leadership opportunities. I think if you're using that, again, I think the whole like non-traditional path is not nearly as non-traditional anymore, right? It's happening a lot more often and a lot more common. So I think I would worry a little less about that and more so just being productive during that time.
Thank you both for that. I have another question about what advice can you give to students who struggle with imposter syndrome, especially when you're at like a predominantly white institution?
Yeah, the imposter syndrome is real. I am, how old am I? 36 now. I've been in medical education for a while now, as I shared kind of with some of y'all. I think some days are better than others, right? But I think what I would tell you is, I don't know who this person is specifically individually, but I would tell you, one, you are competent, you are capable, you are able, right? I don't know who you are, right? But we are collectively able to. We can do it. It's not a matter of can or can't do it, right? You can do it. It's not going to be easy. We have obstacles to overcome. We have histories and experiences that, again, for me, drive me, right, and push me and propel me forward. But at the same time, I have to be honest enough with myself to recognize that they've come with some shortcomings, right? And I have to address them and kind of get better. So I think the truth of the matter is, like, imposter is real, man. I struggle with it. I've struggled with it hard, much more before. Even now, though, right? I never felt like I belong. I never felt competent. I never felt capable. I always felt like somebody is better than me, or like I don't fit in, and like, oh, maybe we let the wrong Abraham Gallegos in, even though that's not a super common name. But like, I think the reality is, first, I want to just dispel the notion, like whether this person or any of one of us is questioning whether we are capable and competent. You absolutely are capable and competent. again, whether you want to do it and you should do it, that's a whole other conversation. But whether you can do it, you absolutely can. Again, it's hard, right? Interact with like-minded people, right? Interact with allies, right? Build your community, build a network, right? Honestly, I mean, the UCLA prep program was super important for me. A lot of it had to do with, yeah, the exam crackers and MCAT studying, but a lot of it just had to do with, it was so refreshing to see so many people of color pursuing medical education in one building, right? I was like this person, right? I felt like a complete outsider. So I think part of it is just recognize when there's a big group of us, right? And get connected with those, build your network. And then I think we have to learn to be a little bit just again, balancing being just real honest with ourselves and not beating ourselves up too much, right? And what I mean by that is, like, life is hard, medical education is hard. This is a marathon and like a lifelong journey, right? So I think sometimes we like beat ourselves up because, oh, I didn't study that one day or whatever, you know what I mean? So I think just putting it into perspective and just recognizing that this is a really long journey, get strapped in. But again, specifically, like, look, we have to be honest with ourselves. How can I get better, right? How can I be a better student? How can I be a better applicant? How can I be a better health service researcher, right? Look at my deficiencies, see where I can get better. But at the same time, you know, slow and steady, just keep moving forward. But yeah, again, it's something that's not easy, but it gets easier with time. But I think, again, use it. I think instead of trying to get rid of it, I think just use it, put it in perspective. Again, just kind of really trying to, yeah, anyways. That's my response.
I agree.
Awesome. So we do have another question that came in, and the question is, after high school, what was the path to medical school like?
Yeah, so again, for me, I went to a really small state school because I didn't do particularly well in high school. I think I might have done well enough to have gone to a UC and stuff like that. But again, like for somebody who was, anyway, yeah, so it was a little tough for me because, again, I didn't wake up in my academic career till like, so anyways, I went to a small state school. And again, for me, it was super helpful. I think my time at Cal State Dominguez Hills was really important for me because I think I would have really struggled if I was a big university, right? And I'm sure a lot of you who went to these big universities straight out of high school kind of had to overcome some of that. But I think I ended up going to a really small state school, which was good for me. Small classes, it was me with, you know, so I think I was really, the attention was focused on me, and kind of that let me just kind of really focus and just dig in. But just that path for undergrad to med school. And again, so after that, I just kind of was a little, anyways, yeah, so that was just for me, for high school and like the undergrad into medical school, right? It was a little just, I kind of struggled a little bit, kind of finding my way, finding my place, not knowing how to apply, where to apply, how to get where I need to go. So again, I think relying on career advisors, career mentors, right? Whether like formally or informally, whether it's through school, whether or other these, right? Mi mentor, right? The truth of the matter is, I'm probably not the best to answer some of like the, like, you know, earlier in the career kind of questions, because that stuff is a little out of my mind as far as like the A through G requirements or what like requirements are needed for med school, right? But you have like this big group at Mi Mentor that is just like, you know, they're like chomping at the bits. That's like where they excel. So, but I think just recognizing, one, using those formals, you know, in your school, but even using stuff like this, right? Like Mi Mentor, relying on people who are kind of going through it with you. Because yeah, it can definitely be a tough path.
Thank you, Dr. Gallegos.
So I have another question about Why did you choose like the type of like research in medicine that you're specifically involved in versus like there's lots of different levels to research, like you know, more bench work, more scientific based versus it seems like you guys do a lot of like community involvement, and yeah, so it looks like somebody is like trying to decide what's best for them. So if you had any advice for them.
Yeah, I think that's a great question. And as for like bench work, and so again, I'm in the area of like health services. It's kind of like community work for sure. But look, the truth of the matter is, I'll be completely blunt. The reason that I'm doing some of the research that I'm interested is because I want to burn this down, not necessarily burn this down, but I want to hold physicians accountable, right? And what I mean by that is when you're talking about, like, again, we see that these disparities exist, right? We see, and it's not just in pediatrics. The truth of the matter is women of color with heart attacks, you can look, there's this really super funny piece John Oliver does on implicit bias. If you haven't watched it, you should watch it. But if you look at any aspect of healthcare, there are disparities from infants, right? From women of color dying at crazy rates in childbirth, right? Particularly the Black community and Black mothers and Black women, ridiculous, right? To heart attack and the management of heart attack. So it's even simple. Anyways, this is not just in one area of medicine. I think for me, it was less so much about the specific area as much as it was, again, these disparities exist, right? I want to really be able to shine like the focus on us as healthcare providers, how we're part of the problem, right? That, yeah, the patient and patient factors are super important, but and the healthcare system, but we as providers, we're contributing, right? And until we look at ourselves and until we're able to like really recognize that we are part of the problem, a lot of this stuff is not going to get better. So I think to me, more than anything, it was less about the specific topic as much as it was disparities care can kind of, and developmental delay specifically, disparities in developmental delay can be really kind of subjective, right? There's some interesting studies that have been done. When you have like really clear like algorithms in medicine, or when you have very clear like instructions and you know what to do, you don't see disparities nearly as much. So one of them has to do with like head trauma in kids, right? There's like a pretty good algorithm. You kind of know what you need to do. And there's like 3 different like scenarios. And you see essentially if a kid hits their head, they're kind of like green, yellow, red, right? If it's red, they need to get a HEV-CT scan and you kind of need to work them up. When you look at the kids who are getting the reds and kind of getting CT scans, there are like no disparities, right? You see the same number of kids of color getting CT scans appropriately that they should, as opposed to those greens and opposed to some of the yellows, right? And I just say this to kind of highlight the use of algorithm. Kind of when you know what you need to do, you're less likely to see disparities. You can still, but at least for me with developmental delay and disparities, a lot of it is kind of like gray zone and kind of just iffy. It's not so much, oh yeah, you got developmental delay, I know it, I'm sending you. That's not how it is. You're there talking to parents. It really relies on that patient-physician interaction. And as the physician, really being able to effectively communicate with patients, with parents. So how's your son or daughter doing, right? How's their development doing? And then it really kind of depends on that relationship. And so again, I thought it was a really good opportunity to use, again, this just general idea that I really want to hold physicians accountable and our healthcare systems accountable. And again, developmental delay disparities just kind of, it was a really good opportunity for that.
Yeah, I agree. I think that one way to change the system is definitely from within. So whatever it is you're interested in changing, improving, adjusting, learning more about it, and trying to see how you can make an impact is very important. And as far as research, just to reiterate, there are many different types of research, and whether whether you've tried, let's say, biomedical science research, let's say that you've tried to do a few Western blots and SDS pages in the, in the lab, and you figured out that it wasn't for you. Or let's say you've looked into public health research and you wanted to do something a little bit different. Well, there's a lot more. And so for anyone that's really looking into exploring research, I would say a Google search or a literature search of whatever you're interested in it would be a good idea just to get familiar with what's already been published and perhaps what you can work on in the future.
Yeah, but as far as like that bench research, I feel like that's just the truth. Like a lot of us, you kind of have to do that. I think, especially when you're undergrads making your way to medical school, that's just the truth. Truthfully, a lot of I think spent some time when I was an undergrad a while ago doing Western blots and all that stuff, right? So like for sure, right? If that's an area of interest, like do it, right? I mean, be who you are and be where you're at, and like by all means. But I think what's also super interesting about health services is it's one thing to kind of create, if you will, new drugs or new advances in medicine. And for sure, absolutely, they're obviously needed. But it's another thing to apply them into kind of our broken healthcare system. And so, and again, I think where myself, like I want to be part of, if you will, like, the solution. I want to be part of improving the, the not just the development, but like the actually rolling out and, those healthcare and so yeah.
All right. Well, thank you all for answering all of those questions. We didn't get to go through each of those individual questions, but like I mentioned in the chat, if any of the attendings here whose question wasn't answered, please fill out the post-event survey that Mary just put in our chat box, and that would give you access to our to their email address. But to wrap it up, we can probably we can start with Argines and then Dr. Gallegos. Any last minute or like advice that you would like to provide to our attendees here?
Yeah, no, like I'm super happy to have been here. I wish it would have been, nice to like know just specifically where some of the folks are coming from, but like the bigger all arching theme, wherever you end up, wherever, right? Like we can do it. You're capable of doing it. I think that's I think we waste a lot of energy in questioning whether we can or can't do it. We can. But I'm not going to sugarcoat it, right? There's no magic pill. It's hard. It's a grind. I think it's sure you want to work efficiently and stuff like that, but get involved with other community, right? And what I mean by community is people like me, Mentor, right? Surround yourself with like-minded people who have similar experiences. They may not go to your same school, but maybe they're part of this bigger group, and me, Mentor kind of helps bring it all together. Don't do it alone. You're not alone in this struggle. It's a struggle. It's tough. It's a grind. Absolutely. We're capable of doing it. But ultimately, our communities need us, right? Whether you're specifically coming from the Latinx community, like the Latinx community is not the only community dealing with a lot of these disparity issues in healthcare, right? Or you belong to another community, right? There are plenty of communities that are struggling. So, and again, if you happen to be in this meeting, and again, communities need us out there, right? So I think, yeah, just keep going, keep grinding, take community, and kind of ultimately keep that bigger picture in mind.
Yeah, and you spent your Thursday night here, so that really is something that's important. And the more people that you surround yourself with that want to make this kind of an impact and are supportive, you'll have people rooting for you. So Mi Mentor is that and much more.
Yeah, look, please reach out to me. I'm still pretty early on here at my Kaiser, so I do have a good amount of time. I'm happy to interact with anybody in any other capacity, set up a time to meet, email, have a Zoom, or look, I mean, I'm still pretty early on here, so I have a little more time. Please reach out to me. I'm happy to be of any service that I can.
Yeah, and I'll do a quick plug. I'm not sure if this is breaking news or anything, or breaking rules. But I think there's going to be a Together We Wellness event coming up. So Dr. Montes would be the person to check in with about that. And I'm going to be volunteering some of my time to coach some students. So if anybody's interested in that, Dr. Montes will provide you more info.
That's awesome. Thank you, Dr. Gallegos, and thank you, Argines. So yeah, no, Together We Wellness is a really great resource, and stay tuned, y'all, for a lot of great events that Mi Mentor is having the second semester. We have one coming up for our health, high school students and community college students, happening in February. We also have other programs around, if you're interested in anesthesiology, we have a series of workshops that is being facilitated by Dr. Padilla. So yes, follow our Instagram, follow Mi Mentor, and then you'll definitely get more information from there. But thank you everybody for joining, and y'all have a great rest of your evening.
Thank you.
Thank you.
All right.